I'm here to talk to you about falls. You see, cats are lucky. When they fall, they land on 4 feet. Humans, we aren't so lucky. We may have injury, long-term health consequences, or death due to a fall. Many people who are listening today may say, I don't need to worry about falls. That's just an older adult concern, or maybe just a concern for our patient population. Well, let me tell you a story. Just last weekend, I was out for a jog, and then bam, all of a sudden, I was on the ground. I had had a fall. I had the bumps and bruises on the left side of my body to prove it. Now, I'll tell you, I was lucky. I didn't have any serious consequences, and I'm not a senior. However, as we age, adults over 65, they experience more falls, they become more debilitating, and more costly. 1 in 3 older adults will fall annually, and this is a growing problem. Over the last 10 years, there's been a 39% increase in falls. Men are more likely than women to die from a fall, and Caucasians experience worse outcomes from falls compared to African Americans or Hispanics. Falls are also the leading cause of traumatic brain injury, accounting for 47% of all TBIs. Falls have many risk factors, such as physical inactivity, chronic conditions, and these can all be linked to other public health problems, such as obesity. We're seeing less activity, we're seeing more chronic conditions, and less physical activity over our population. So it's no surprise that we're seeing more falls among our adults 65 and older. Addressing the issue of falls is no easy task, but I would argue that adults of any age can take steps to avoid a fall in the future. Falls have multiple risk factors, making it difficult to pinpoint the source of a single fall. Some of the most common risk factors include poor balance and gait, taking multiple medications, and how those medications interact, particularly medications that cause dizziness and drowsiness. Having a chronic condition, such as arthritis, dementia, or diabetes can lead to a fall. Sensory changes, particularly those in vision and hearing, which interfere with our ability to understand our environmental cues. Muscle weakness, especially of the lower body, can be a risk factor for a fall. And postural hypertension. You know that feeling when you're a little lightheaded when you get up from lying down to standing up? That's a risk factor for falling. Environmental hazards around our home. And independently, even in and of itself, fear is a risk factor for falls and may change how we move about our environment or the activities we choose to participate in. So not only are there multiple fall risk factors, there's a cyclical effect to these risk factors. Let's take a look at an example. So here we have someone who's decreased their physical activity. As a result, they start experiencing poor balance, maybe a little bit of frailty. They're not moving around their environment as nicely as they would. They become fearful that they're going to fall. That fear continues to restrict their activity, which also continues to increase frailty, which is going to impact that person's ability to participate in the activities they enjoy, reducing their quality of life. As they continue to reduce participation in their favorite activities, maybe it's going for a walk around the block or shopping with their family, they begin to isolate from others, which in and of itself is going to deteriorate their health. But the behaviors that we do or do not do now will impact our future risk for falls. First, I would tell you to strive to have a complete physical activity program. This physical activity program should include endurance activities, strength and resistance training, balance and flexibility exercises. Second, manage any of your chronic conditions or your risk for chronic conditions. Control diabetes or control your diabetes to prevent or delay onset of neuropathy that's going to impact how you feel the ground under your feet. In addition, I would encourage you, if you have chronic conditions, to have your medications reviewed by a pharmacist or other healthcare provider. Doing this will alert you to any potential interactions that you may experience. And finally, I would tell you, evaluate your environment. The CDC has a wonderful checklist to help you check each area of your home for fall risks, but I would tell you, check your bathrooms for hazards of slipping. In addition, look at your lighting in the hallways and pathways around your home. And lastly, reduce clutter and check the handrails on your stairs just as a starting point. Taking steps now to manage health and prevent falls will save us thousands of dollars in healthcare costs over time. An average hospitalization for just one single fall can cost up to $35,000. Medicare costs range from $14,000 to $21,000 per fall. But on the other hand, programs like Tai Chi have a $5 return on investment. In addition, we see programs like A Matter of Balance, a discussion-based program to help us reduce our risk of falls and our fear of falling. And we've seen programs like that have a $938 savings in unplanned hospitalizations as well as home care costs. So I think the choice is clear as where we want to make our investment into a nice preventive community-based program versus those very costly hospitalizations. So today, as you consider and learn more about fall risks, I ask, what will you do to prevent a future fall?